Today we'll be revising the parotid gland. And it is usually asked under the headings of external features, the relation, the nerve supply, and applied anatomy. Starting with the external features, it is the largest salivary gland. It weighs around 25 grams, and it is the largest salivary gland. It's a three-sided inverted pyramid in the parotid region. And it presents the following features. It has one apex that is directed downwards, and one base that is directed upwards, and three surfaces that would be one is superficial, which is the largest, the superficial, the posteromedial, and the anteromedial. And it has three borders, which is one is posterior, anterior, and one medial. There's three borders. Going on to the next topic, that is the relations. The apex. First, the apex. The apex is related to the posterior belly of digastric muscle. And it is also related to the cervical branch of facial nerve. Is also related to the anterior and posterior division of retromandibular vein. Going on to the next topic, the next thing is base. Base is related to the posterior surface, posterior aspect of TMJ, temporomandibular joint, and it is also related to the external auditory meatus. And the external carotid it's also related to the superficial temporal vein, and the auriculotemporal nerve. The second and the third, these two are important. Actually, we don't usually remember this, so I'll just highlight this vessels. And the third one is the superficial surface, the largest superficial surface. From above downwards, we can see the skin. First, it will be the skin. Then it will have the superficial fascia. As every organ has it, superficial fascia that has three things. One is the platysma. One is the superficial lymph node, and one will be the great auricular nerve. Branches, not the entire nerve, the branches. Then we'll have the parotido-masseteric fascia. And the last will have the deep parotid lymph node. Moving on to the anteromedial surface. Third is fourth, anteromedial. It is related to the masseter, the posterior border of the ramus of mandible, and the medial pterygoid. The posteromedial surface is related to the mastoid process, and the muscles surrounding it, which would be the sternocleidomastoid and the posterior belly of digastric. And the styloid process and the muscles surrounding it, which would be the stylohyoid, the styloglossus, and the stylopharyngeus. Styloid process. And the facial nerve trunk, and the external carotid artery. Enters through this surface. And the borders, the anterior border from above downwards. Okay, we'll divide it into two parts. This is the part where there is parotid duct. From above downwards, we'll have the temporal branch of facial nerve. Then we'll have the transverse facial artery. Then we have the zygomatic branch of facial nerve. Then we'll have the upper buccal branch of facial nerve. Then we'll have the parotid gland, and then the lower buccal branch of facial nerve, and the marginal mandibular branch of facial nerve. The posterior border is related to the posterior auricular nerve. Posterior border related to the posterior auricular nerves and vessels, posterior auricular vessels. The medial border is related to the lateral wall of pharynx. We'll draw a diagram and see the relations. This is a rough sketch of the parotid gland. This is the external auditory meatus. We have the apex here, and as we saw at the posterior belly of digastric muscle, the cervical branch of facial nerve, and the anterior and posterior division of retromandibular nerve. So this is the posterior branch of retromandibular nerve, the anterior branch of retromandibular vein, Then we have the cervical branch of facial nerve. Then we have the what was the last? Anterior border. This is the anterior border, right? This was the apex, and now this is this was the apex, and now this is the anterior border. So we have the, what was the last? marginal mandibular branch of facial nerve, the lower buccal branch of facial nerve. This was the parotid gland. Then we have the upper buccal branch of facial nerve, and the zygomatic branch of facial nerve, and the temporal branch of facial nerve. In between them, we'll have the transverse facial artery, and then the base was related to the base was related to the superficial temporal vessels and the auriculotemporal nerve. So we have the auriculotemporal nerve over here, and we have the this is the superficial temporal artery and the superficial temporal vein. On the posterior border, we had the posterior auricular nerve and posterior auricular vessels. So we'll have the posterior auricular vein, the posterior auricular artery, and the posterior auricular nerve. This is the rough diagram of the relations of the nerves and vessels, and then we'll do the horizontal section through parotid gland. This is the skin of the parotid gland. A rough diagram of how the parotid gland would look. This would be the posterior ramus of mandible. This is the mastoid process, and we have the skin. Then we'll have the superficial fascia. Then it contains the nerves, the branches of great auricular nerve, and we'll have the parotid lymph nodes over here, and then the muscles. This is the muscle. Here we have the medial pterygoid on the mandible, ramus of mandible, medial pterygoid, and this would be the masseter. This is the medial pterygoid and the masseter. Then we have the posterior belly of digastric, is the sternocleidomastoid. We have the external carotid artery and the posterior in the retromandibular vein. We have an internal jugular vein over here, then internal carotid artery. This would be the styloid process and the muscle surrounding it. It's like a flower, the muscle surrounding it. We'll have the nerves over here, which are the 11th, 12th and 9th, 11, 12 and 9, and one over here, there's the 10th, 9, 10, 11, 12, 9, 10, 11, 12, and the nerve and the entry of the facial nerve. And that is the pharyngeal wall. It's a rough sketch of the horizontal section of parotid gland. Moving on to the nerve supply. We have three types of nerve supply. One is the parasympathetic. Two is the sympathetic, and three is the sensory. This is parasympathetic is secretomotor. This is vasomotor. Sorry, the handwriting is pretty bad. Okay, we'll study about the first parasympathetic nerve supply. First, it has a preganglionic fibers that preganglionic fibers that arise from the inferior salivary nucleus, and it travels to the otic ganglion. Otic ganglion. The course of the preganglionic fiber is the inferior salivary nucleus. Then it goes to the glossopharyngeal nerve. Then we'll have the tympanic branch of glossopharyngeal nerve. Then it is related to the tympanic plexus to the lesser petrosal nerve and the otic ganglion. It's related onto the otic ganglion. And the postganglionic fibers arise from the otic ganglion and reaches to the parotid gland travels through the auriculotemporal nerve. The second is the sympathetic or the vasomotor nerve supply. It arises, the preganglionic fibers arises from the T1 segment of spinal cord, and then it travels to the superior cervical sympathetic plexus. Then it is then the postganglionic fibers start from there, and they run along the some artery, and then it supplies the gland. The third is the sensory, which is the auriculotemporal nerve, and the great auricular nerve. The diagram for it is, imagine this is the brain stem. The inferior salivary nucleus is over here in the medulla, and it comes out here, which is the tympanic plexus. It is the tympanic plexus. Then it comes out as the lesser petrosal nerve, which enters the foramen ovale and reaches the otic ganglion. The postganglionic fibers arise from this. If this is the parotid gland, reaches over here, and it travels to the auriculotemporal nerve. This is the parasympathetic fibers. The sympathetic fibers start from the T1 segment of spinal cord, the spinal segment. It reaches the superior cervical sympathetic plexus. It starts from here, winds around an artery, probably the middle meningeal artery. It winds around the artery, and these are the postganglionic fibers that reach the parotid gland. Both the sympathetic and the parasympathetic nerve supply. The applied anatomy for this is, one would be mumps, viral parotitis, that is the mumps, inflammation of the parotid gland, and in adult males it may cause complications like orchitis, and in females it causes euphoritis, and in both it causes pancreatitis. The second applied anatomy is the parotid swellings, which is very painful because of the unyielding nature of the parotid capsule. It's very thick, and it does not change position. So when the parotid gland swells, it causes a lot of pain. Then we have the Frey syndrome, in which the auriculotemporal nerve and the great auricular nerve branches are damaged, But during regeneration, the secretomotor fibers of the auriculotemporal nerve join the fibers of the great auricular nerve. When it is being regenerated, the branches of the secretomotor branches of auriculotemporal nerve joins the fiber of the great auricular nerve. As a result, the stimulation of the parotid gland causes a lot of sweating and redness in the area supplied by the great auricular nerve, which is mainly the parotid region. That's it about the parotid gland.